Okay, thank you so much, Stefan. This just coming through. We are learning that Premier Doug Ford and Education Minister Stephen Lecce will be making an announcement today at 10 a.m. after announcing yesterday that the Ontario government is delaying the return to in-class learning for elementary students. So instead of returning on Monday, students will continue online learning. And that return will now coincide with the high school students on January 25th. But the government will also be reviewing that return date in a couple of weeks to determine if it is safe to go back. Let's look at those numbers now. Yesterday's number, the province breaking records for both new cases and deaths, reporting 3,519 infections and 89 fatalities on Thursday. And this is the breakdown for regions as well. Now, reports suggest the numbers coming out later today will be startlingly high. Possibly over 4,000. A caveat, though, the number could perhaps be from old data backlog. So we'll be watching that one. And as those numbers continue to rise, Dr. David Williams saying that putting Ontario on a curfew is not off the table.
That's one of the things we will consider. We know that Australia did undertake that in the Melbourne area, and other countries have done some. So we're going to look at that as well. Part of the challenge of the curfew is how are you going to enforce a curfew?
In Quebec, the Montreal Police Service saying it will deploy the necessary staff to ensure people comply with the government's overnight curfew that starts tomorrow. It's going to last 4 weeks from 8 p.m. to 5 a.m. with fines of up to $6,000. All right, but how much would a curfew actually help? To discuss that and more, and especially with the latest with education, joining me now, epidemiologist Dr. Colin Furness. Good morning to you.
Good morning.
So I want to begin first with education. Do you agree with this decision to extend the online learning?
I can't give you a straight answer, and the reason I say that is because keeping kids out of school, especially primary school kids, is devastating. The learning is not happening. Parents are unable to go to work, especially poorer families. This is a huge problem. That said, if we send kids back in with the high number of cases we have, we're going to make the situation worse. And so there's a third way, which is you open schools with testing. You test every kid on the way in. That would be the way forward, and I'm really disappointed that Mr. Ford isn't even talking about that.
We're looking at the positivity rates, and some of them are alarming among the youth, upwards of 20%. And they say they were going through those numbers when they made the decision saying for elementary students to go back on January 11th. The number wasn't that high. So are we now seeing what's happening with the holiday effect, the Christmas gatherings?
I believe that is exactly what is happening. I actually thought by today it would be worse than it is. So in some ways, I think the restrictive measures we have in place are having a positive effect. But if numbers continue to climb, we're going into a bad place, no question.
Mm-hmm. Do you anticipate that students will be back, on the 25th? We keep saying at least the 25th, but obviously that's going to need to be monitored, the numbers.
We need a change of thinking in the Premier's office. We can't keep locking people up. We need to do testing. We need to control transmission through testing. So it all really depends on whether the Premier's office is willing to consider that finally. It's something I've been saying since last spring. I'm not optimistic he's going to hear it, but this is the way forward. If we do a curfew, if we do a big lockdown, in Australia that took 100 days. That would be pretty brutal. And we're not going to be able to keep donut shops open and convenience stores open and the same kinds of ways we've been doing that. So it would be really difficult to do here.
We've been hearing, and the government has been criticized for this very slow vaccine rollout. They are starting to pick up the pace. We are not yet at the pace that we need to be in order to hit those targets. What is your take on that?
Well, the person tapped to lead it, General Hillier, respected general, smart guy, no experience in vaccines, no experience in public health. And at least in the early days, it was very clear he wasn't getting any advice from people with that expertise. So we stumbled and we fumbled. That said, he is a smart guy. I think we're on his learning curve. I think he's getting that figured out. We're probably going to end up running out of vaccine by the end of January. In other words, the bottleneck is going to go back to being not how fast can we get needles in people's arms, but how fast can vaccine actually arrive in the country.
Indeed.
So I think that's where we're going to be.
You've been very outspoken when it comes to outdoor gatherings as well, because a lot of people say, hey, listen, I'm outside. I'm safe. I'm fine. What do you say to that, and what sort of things should people keep in mind?
Being outside is always going to be safer than being inside. But we have to also understand that respiratory viruses behave very differently in cold weather. This is why we have flu season. This is why we have colds in the winter and not in the summer. Viral particles that you exhale stay alive a lot longer, and they stay in the air a lot longer. And the lining in our own noses, mouths, and throats tend to dry out more in dry, cold air. That makes it harder for our bodies to filter these things out. So what was safe enough in the summer, what was okay to be kind of up close in the summer, if you remember the Black Lives Matter protest, people were cheek and jowl and often not wearing masks. We didn't see infections from that. But if we were to do that again today, I think we might. And so I just want people to be careful, just to be careful that being up close is not a good idea. And if you're going to be, then have a mask outdoors.
Yeah, we were seeing some of the B-roll there of people skating and tobogganing. We've seen a lot of the tobogganing hills get very busy. So, hey, listen, it's cold already. You might as well just hike up that mask or keep the mask on, the balaclava, whatever you got to get on there to keep yourself safe. Dr. Colin Furness, as always, appreciate your insight. Thank you.
Thank you.